Coronavirus. Hello and welcome to the Daily Coronavirus Update live from Fox. My name is Gasia, Mikaelian. We'll be live streaming for you every day at 1 p.m. Eastern, 10 a.m. Pacific to bring you the latest information on the coronavirus outbreak nationwide and what's happening around the world. Fox has been busy tracking the latest numbers, so let's bring you what we have, and we'll start with confirmed cases of the coronavirus. Worldwide, there are now at least 95,270 cases. In China alone, there are at least 80,565 cases of the coronavirus. Here in the United States, there are at least 129 confirmed cases of the coronavirus. So let's focus now on some notable jumps we've been tracking over just the past 24 hours. We'll start in South Korea because that country now has 5,766 cases. That's up from 5,328 yesterday. That's just more than an 8% increase. We'll swing down to Italy, where there are now 3,089 cases, and that's up from 2,502 yesterday. That's a much bigger jump, one of almost 24%. In Iran, there are 2,922 cases. That's up from 2,336 yesterday. That's another 25% increase. Germany has 262 cases, up from 196 yesterday. That's a jump of more than a third, more than 33% increase. In the United Kingdom, there are 90 confirmed cases of the coronavirus, and that's up from 51 yesterday. So the UK has just seen a 76.5% increase in the number of confirmed coronavirus cases. So let's focus on what's happening here at home in the United States. There are 13 states with confirmed coronavirus cases, and the top 5 are on your screen right now. California has at least 43 cases. And just so you know, I'm speaking to you from the Bay Area in California. Up north in Washington state, they have recorded at least 39 people confirmed to have the coronavirus. In New York, there are at least 6 people with coronavirus. In Illinois, at least 4 people are confirmed there. In the number 5 spot, we have Oregon and Florida. Each of those states has at least 3 confirmed coronavirus cases. Joining us now is health reporter Dina Centofanti. You're at Fox 2 in Detroit. Thanks so much for being with us, Dina. Such an important topic. Tell me a little bit about what's happening there in Detroit, but also let's look nationally.
You know what, and I'm so glad that we're doing this. This is such an important initiative because we are hearing from so many viewers, some who are saying, why are we making such a big deal about this? But those numbers that you just read, Gasia, really reflect how fast it's spreading. And that's the concern. So the goal of this live stream is not to alarm anybody, not to scare anybody, but just to bring good information that we can constantly update, because I think that's what our viewers are asking for, to know what do they need to be doing to prepare. So one of the big stories that we're talking about today is a cruise ship, which is now off the coast of California with passengers being quarantined, told they cannot get off that cruise ship until they figure out exactly how big the risk of coronavirus is there. Let me go back a little bit. This may sound familiar because this is what happened. There was a cruise ship that was quarantined off the coast of Japan for 2 weeks. You remember this was last month, and that was a bit of a disaster. There were concerns about cases of coronavirus on that cruise ship, and sure enough, hundreds of people, about 700 people it's estimated, contracted the virus on that cruise ship, the one that was quarantined off the coast of Japan. Many people said it was like a petri dish. So that begs the question, what do we do now? And that's one of the big concerns, is keeping this from spreading, and also making sure people understand that 80% of people who do contract coronavirus are probably going to be okay. So there is fear, but we're also trying to make sure to bring some calmness to people so they understand the real impact of this virus.
You know, Dina, you're exactly right in saying that a lot of people are very concerned and wondering if there's too much hype, if you will, about the coronavirus. I'll tell you, I'm speaking to you from the Bay Area here in California. Yesterday, about this time, we just learned that our state recorded its first death from the coronavirus from a man who lives just outside the Bay Area, and he was on that cruise ship that had been quarantined. So I don't know if you're seeing it, but in communities where it's been okay or not that many cases, then all of a sudden you see either a spike in the number of cases happening or word that someone in their state has died. That really does tend to ratchet up the concern.
And that's what we're all wondering, and that's why it's the unknown. I think that's what drives fear in all of us. It's the unknown, and that's what we're seeing with this coronavirus. Here in the state of Michigan, monitoring hundreds of people, and some of them are self-quarantined, some of them are being monitored by medical professionals. Waiting to see if they show any signs of symptoms. These are people who may have had an exposure. So those people are being monitored. Most medical experts are saying it's not a question of if the coronavirus is going to come to your state, it's a matter of when. And so that's why we're trying to get some good information as to how to prepare. Now, we are seeing people who are going to the store and stocking up on everything, toilet paper, water bottles, hand sanitizer, of course. This is a pantry of a woman in the Metro Detroit area who she said that she is going to be prepared with food for months. So that's probably one of the overreactions we're seeing to this fear. But at the same time, people don't know if they're going to be told they have to be quarantined in their own home so they don't risk spreading the coronavirus. They want to be ready for it.
Now, Dina, I'm sure in your long years as a medical reporter, you never expected to talk about the importance of hand washing. We have heard it at work. My little boys get it at school. I think it's happy birthday twice. Kind of run us through the most common sense advice.
It does, and people are saying, stop telling us to wash our hands. But I will tell you, the doctors are saying that as the simple act of washing your hands for 20 seconds, it can kill the coronavirus. And that's why it's being reiterated so many times. It's such basic kindergarten hygiene lessons, but it's super important. And if you can't get to soap and water, then that's when you're turning to your hand sanitizer. I want to bring in our doctor here because we have answered a lot of viewer questions, and I want to continue to do that, answer some of the questions that some of you across the country may be asking right now. And one of them is about this hand washing lesson that we keep getting. Dr. Suleiman is an infectious disease doctor, Henry Ford Health System. Doctor, just tell us, when you talk about the importance of washing your hands, and we get it, we know that's important, why is that so key right now, though?
I mean, it's always been the key for any type of infection prevention, really. It's the most basic thing you can do to prevent transmission, the spread of viruses or any other infection. We emphasize it in the hospitals and everywhere else. So it's not a new concept.
No, it's definitely not new.
We're just stressing it because it's so important, and it does a very good job of preventing the spread of germs.
I do want to talk about, and I've got some questions behind me. Everybody who's watching this, either if you're on the app or if you're watching on a live stream, I'm going to bring up some of these questions that I think a lot of people are asking. Is the virus airborne or droplet? So this kind of goes to the impact of washing your hands when we talk about droplets. And by the way, that's how the flu is spread as well, is through those respiratory droplets, right?
Correct. This virus is droplet, not airborne. So it really, you have to be close to someone within usually 3 to 6 feet in order to get the virus.
And they're either coughing, sneezing, or talking with a lot of spit, right?
Yes, and the droplets are large enough, and because of the size, they drop to the ground, so they can't hang out in the air for long. So that's why it's a little different than the airborne, like the measles, for example, an airborne virus.
Okay, and the reason we talk about washing hands so much is because when you talk about these respiratory droplets, if I sneeze, and then I touch a doorknob, touch an elevator, grab a phone, anything.
You're contaminating everything,
and
essentially.
The virus, how many hours are we saying that this coronavirus can live on a surface?
This one, we're not exactly sure, but for most coronaviruses, it's usually a few hours. Some have lasted for a couple days, but generally it's a couple hours. And we know that heat does kill it, so.
Okay, so let's talk about some of the other good questions. Some people are asking about, we're in a global society now where we're ordering things from Amazon every day, it seems like, things coming from all over the place. Can it be spread through the mail?
I do not think so.
Okay.
And this is why, again, hand washing is important. You touch things, you wash your hands, don't touch your mouth, your nose, or your eyes. Then you should be relatively safe.
Let's talk about these comparisons to the flu, because a lot of people are saying, look, a billion people have contracted the flu across the globe. It's about 100,000, I think, at this point, if we add them all up for coronavirus. What is the big deal with this? So can you put that in perspective for us, doctor, to understand? And it does have some similarities to the flu.
The coronavirus is acting like most respiratory viruses, and it does cause symptoms similar to influenza. And I think the main reason why people are sort of uncertain is because there's a lot of things that we don't know, and we're still trying to figure out. Things are changing rapidly, so we're trying to figure things out, and I think that's what's really driving some of the fear. But it's acting like any other virus. And with influenza, it's been around for so long that I think we've gotten comfortable with it, and that's where we see the difference.
So let's just break that down a little bit when we talk about it's an upper respiratory virus, and the symptoms are very similar to the flu. You talk about a cough, a fever.
Those are so cough, fever are common. The shortness of breath is not everybody, but they can still get the body aches, the other symptoms that you do with influenza or another respiratory virus. So some people will have mild symptoms where they don't develop the shortness of breath or the cough.
And that sort of answers Susie's question, how do you know the difference between the flu and the coronavirus? Is tricky, right?
It's tricky, and so in Michigan, the most likely thing you'll have is influenza because that's what's spreading, and we still have a high rate in Michigan and most states. It is circulating, but with coronavirus, we'll have to basically look at your risk factors, your exposure, then we will consider it, but most likely it's going to be influenza if you have the symptoms.
And just one more quick question, doctor. People traveling, they're worried about this, and I know we're going to talk more about this in our conversation today, but planning a trip to Disney World, we are senior citizens, what precautions should we take?
The same that we are recommending for the general public, essentially washing your hands, not touching your face, and making sure you stay away from sick people. If you cough or sneeze, to do it in a tissue and to throw it away, wash your hands after. Those are the basic things we are recommending. And if you're sick, not to go out in public and expose other people.
All right, it's good information, and we're keeping an eye on it, updating the story all the time. For now, we'll head back to studio.
All right, Dina Centofanti, thank you so much for some good advice there on how to deal with this coronavirus crisis that we're all in. Put a quick pause on Dina. I want to mention to you that you are watching now a daily coronavirus update. We're bringing you live from Fox. My name is Gasia, Mikaelian. We're going to be live streaming for you every day starting at 1 p.m. Eastern, 10 a.m. Pacific. Our goal is to give you the latest information on the coronavirus outbreak nationwide, to calm your fears, but also to keep you informed with what you need to know. I'll mention here in just the time we were listening to Dina and the doctor, I was informed that Illinois just saw, I believe, its fifth death or its fifth case from the coronavirus. If I can get some confirmation on that, I know that Illinois originally, it's the fifth case or the fifth case of coronavirus. Good. So I misspoke a moment ago. It is not a death. It is another confirmed case. So that is news we'd like to bring to you. If we can, I'd like to also hear from Governor Gavin Newsom talking about California and how he declared a state of emergency in his state.
Thank you all much for joining us. We want to give you guys an update on where we are as it relates to COVID-19, the novel coronavirus. I wanted to answer any questions you may have, give you an update on the numbers, and reflect the news on the first death in the state of California related to COVID-19, which obviously marks a profound moment in our state and, more importantly, profound moment for the family members that lost a loved one. And our hearts go out to that individual. As you know, just recently, in the last few hours, it was confirmed in Placer County that individual passed away. Number of cases in the state of California is 53, and I want to just reinforce that. It's 53. I've read a lot, seen a lot, been a lot of media reports about the number of people that have tested positive in the state of California. That number as of today is 53. I'll remind you that includes 24 individuals that were repatriated in the state of California, 29 individuals that have subsequently been tested positive. As you know, we moved into the phase of repatriation going back early part of January, more formally at the end of January is the first phase of our engagement as it relates to the novel coronavirus. The second phase of that was monitoring people that had come through both San Francisco International Airport as well as LAX. That number at the time, you may recall, was 8,400. Now we estimate that number to be closer to 9,400 people that we are monitoring in over 49, in fact, directly 49 counties in the state of California. So first phase of our engagement on the coronavirus, repatriation. Second phase, the monitoring of people that came in on commercial flights through those two international airports, and those are currently being monitored, again, by 49 jurisdictions in the state of California. That number now totals 9,400. The third phase was last week or so, first community spread case in the state of California, here in Northern California. And as you know, community spread is no longer just in the northern part of the state. We've had a number of incidences throughout the state of California, no longer north, now in Southern California. We have accordingly, with this new ICU patient that passed away, entered into this next phase that has required me, under the circumstances, to advance a proclamation of a state of emergency in the state of California. This is not something that I say hyperbolically and shouldn't be reported as such. It would be incredibly misleading. The proclamation is to serve to help advance our resources, to loosen up our regulatory environment, to provide some clarity in terms of jurisdiction and oversight capacity as it relates to the access and utilization of state properties, be it fairgrounds or other state properties, and allow us to preempt local land use if indeed we feel that is appropriate. It allows us on the competitive bidding frame to move forward with our kind of procurement that's necessary with the sense of urgency on medical supplies or other monitoring or suppression efforts.
That's California Governor Gavin Newsom speaking about mid-morning yesterday, speaking right after California announced its first death as it relates to the coronavirus. Immediately after that, we saw an impact on stocks, and I'd like to take you live to the Dow now, where we see another steep dive. It's been a real roller coaster now for almost 2 weeks. Take a look. We are almost at the lowest numbers we've seen all morning. The Dow has lost almost a full 1,000 points. It's dropped more than 3.5%. It was down sharply right at the opening, and here we are ever deeper into the red. I'll take a peek at what's happening on the NASDAQ. The story is almost the same percentage-wise. S&P losing almost 3.5%. The NASDAQ is doing just a little better, if you can call a drop of almost 3% there better. But again, clearly a lot of investors nervous about what's happening with the coronavirus nation and worldwide as it relates to business. Some people even speculating that perhaps California's governor taking the step of announcing an emergency made investors even more fearful and nervous, and we saw stocks slide almost immediately after that happened. So let's go ahead and bring in Fox reporter Tom Vakar. You are live in Oakland, Tom. Let's talk about business as it relates here to what the stock market is doing today and the global concerns.
Here's an absolute fact. The market, all of the markets, hate uncertainty. And what they're concerned about is the world going into more difficulties economically? And most importantly, is the United States headed into a recession? That's a very real possibility that was even unthinkable 2 weeks ago. But this has so much of the supply chain worldwide. Behind me, the Port of Oakland, one of the largest ports on the West Coast. They've had a downturn in cargo volume, as have all of the West Coast ports, because of the connection with the Pacific Rim and most specifically China. And that is a problem that is of great concern. So you have all of these companies in the United States, for example, up in Seattle, saying, stay home, don't come into work. Well, that riles the markets, and when it riles the markets, then, you know, your 401k, your retirement plan are all affected by that. That is the situation. Perhaps the signature thing that's going on right now is what's going off just off the coast of California, less than 100 miles from where I'm standing right now, and that is the Grand Princess. Now, the Grand Princess is a 22-year-old, very, very large cruise ship that has been sailing on the West Coast for a long, long time. Currently, there are about 3,500 passengers and crew on that ship. Now, 62 of those passengers and crew have complained of some sort of worry about something that is very, very real, and that worry is that they were on that ship before it sailed off to Hawaii and back, but they were on that ship coming up from Mexico, and there was a man that was on that ship who had later died from coronavirus. So 62 people are very worried about this. And currently, about 11 passengers and 10 crew members have come up with symptoms that are virus-like, which is to say possibly the coronavirus, possibly the common cold, possibly flu, and let's face it, we are in flu season. So helicopters from the United States Coast Guard are going to be taking out to this ship, and may have already done this, 100 or so of these test kits to find out if these people have the coronavirus. No more than 100 people will be tested, but the rest of them are in effect being sequestered and quarantined on that ship until they know. And that ship is not coming into the port of Oakland or any other port until it's cleared by the CDC. When the CDC clears it, then they will have to find a place to park it. But then there's some other issues that go along with that. Where do you park it? Do you park it at the San Francisco cruise terminal? Not very good for local business. Could you park it at a former military base which has deep drafts? Yes, there are. Are there some other places like the Port of Oakland who could accommodate the ship because they also have deep drafts? These decisions will have to be made, but they've hardly been made right now.
Tom,
and as I say, less than 100 people.
I do hate to butt in, Tom. I'm going to get right back to you real quick.
Yeah.
I just want to take a step here to perhaps welcome some of our newer viewers. This is something new that we're doing, you and I together, and many other reporters and anchors across the country, joining in to bring you this live webcast from Fox. We're going to be live streaming this information for you every day, starting at 1 p.m. Eastern, 10 a.m. Pacific, to bring you the newest information, to help calm your fears, to get you informed, to talk about what's happening in your neighborhood where you are. Tom, let's go back to the situation that's playing off just off the coast of California. You mentioned that there are 11 people on that cruise ship, the Grand Princess, who complained of, flu-like symptoms. You've been covering business in the Bay Area for decades, and specifically as it relates to the cruise industry. San Francisco is a huge port. What is this doing to the cruise industry, either just there in your area or nationwide as you see it?
Well, here's the situation. Cruise industry in San Francisco was never a big thing until a few years ago, and this year they've expected an increase of anywhere between 15 to 20% of ships, and that's about 120 ships. The problem is this coronavirus is wrecking the cruise industry because, I don't know if you know this, but about half of all the cruises in the world are centered in North America, 25% are centered in Europe, and about 15% are centered in China. The American component and the Asian component all encompasses the California situation here. So as a result, a lot of cruises have been canceled. A lot of ports have been eliminated, especially in Asia. And as a result, this $45 billion industry is looking at a decline in ridership of maybe 15 or 20%. And that's going to mean big hits to them on the stock market. And that's just one of the many, many worries that the stock market has right now as it relates to what's going on. Other things, Apple is having supply chain problems. Other major manufacturers, supply chain problems, because this is such a complicated world we live in. And the Port of Oakland behind me, one of the very large ports in the United States, also is responsible for bringing in a lot of those parts that can be assembled into something, or bringing in the assembled products to the United States. And all of that is somewhat in a tizzy right now. It's not to say that it's failing, it is not. But you can tell from the stock market that people are very, very worried.
100%. All right, Tom Baker, let's put a quick pause on you, and we're going to welcome you back into our coverage in a minute. Thank you there for your reporting from the Bay Area. Let's take a look at the latest numbers that we have to share with you, and this really should help you identify what's happening in your state. If your state is on the screen now, it is among the top 5 states with the most number of coronavirus cases. At the very top, we see California, which has 43 confirmed coronavirus cases. Washington has 39. New York comes in at 6, which is a pretty steep drop for being the top third state. Illinois then comes in with 5, and that 5th case was just confirmed in the past 40 minutes or so. Then we have Oregon and Florida tied. If I can hold this graphic there on the screen for a minute, it's interesting because most of these are coastal states: California, Washington, and Oregon on the west coast. And of course, you have New York on the east coast, and Illinois is in the Midwest, certainly, and of course, Florida down in the southeast part of our country. So just an interesting observation. Doesn't mean that it's tied to anything, but it's something I certainly noticed, and I assume that you did too. So let's talk a little bit more about the spread of the coronavirus. We talked with a minute ago about with health reporter Dina Centofanti about the importance of washing your hands and not coming in a lot of contact with people. That is just about impossible to do when you are on a cruise ship, which is very close quarters, to say the very least. So let's talk more about this with the doctor. I'm happy to be joined by Dr. Alexander Evans. You're an infectious disease specialist at Marin Health in the San Francisco Bay Area. Thank you for joining us, Dr. Evans.
Yeah, thank you for having me.
It seems almost impossible to stop the spread of any illness on a cruise ship. We've heard of the norovirus, but this is something new.
Yeah, this is something new and something that we're obviously having to deal with since how popular the cruise industry is. And it was just an absolute devastating amount of people on this cruise ship that was sitting outside in Tokyo. 700 plus cases, and that number may increase. And now we have a second cruise ship. And this cruise has already left people about 2 weeks ago, and it made a round to Hawaii and now coming back. And yes, that case that died up there in Placer County came off this cruise ship.
So when you have a number of people saying they feel ill, and then you have, I'm just talking about the Grand Princess now, let's break down the numbers. Some 3,500 passengers and crew members. 62 passengers and crew members complained of some sense of illness. 11 people said they have distinct virus-like symptoms. There are many people who are asymptomatic when it comes to the coronavirus. Do you expect these numbers to be accurate, or could they be far higher than what we're getting?
It's undoubtedly going to be far higher. We just know this. And we're learning a lot more about the virus all the time. And we know when there's one person infected, they're probably going to infect 3 other people unless they're just doing immaculate hand hygiene, which is hard to do, especially in such tight quarters.
All right, let me put a quick pause on you. I'd like to update our viewers with this tweet that just came in from Princess Cruises, and I'll read it with you. A Grand Princess update. We can confirm that while there are no confirmed cases of COVID-19, what we normally call the coronavirus, currently on board, the CDC has identified groups of guests and crew who will be tested before arrival into San Francisco. So back to the doctor here. They're being held on that cruise ship off the coast of California. They're being told they cannot come onto land. What about the idea some have said, look, just test them all, test everybody just to be safe? Where's the problem with that?
Not enough supplies. There's just been a huge issue of testing alone. I mean, just even in the hospital setting where I work on a daily basis, the tests, you get it done, it may come back a day or 2 or 3 later, and it's just sheer supply. If it could be done, it'll be done. And sometimes patients need to be tested more than once, twice, 3 times, because it doesn't necessarily, it's not a perfect test, unfortunately. It's still being investigated.
Let's talk about the people who have been diagnosed with the coronavirus and also those who have died because of it. Is my reading accurate that for the most part, we're talking about older people, adults, not children? And if that is the case, why perhaps could the coronavirus be more dangerous among the older population and not children, who we typically think of as most vulnerable?
It's strange, but it's still relatively new, so we'll see when more data is published from other countries. But yeah, we've not seen much about children. What we have seen about children is that children tend to perhaps carry the virus longer. So they may be minimally sick or asymptomatic, meaning they have no symptoms, but they may be still transmitting in that case. And not only that, transmitting for a longer basis, and they're not even showing signs of illness. And they be some of the risks, what we call patients who are hyper spreaders, who tend to give it to more than just 3 people, to give it to 20 people or more. That's not a common thing, but that's a concern.
Dr. Evans, I have 2 little boys in elementary school, and they got a big old school assembly on the importance of hand washing, front, back, under your nails and all this. I think about, the fact that children especially have their hands in everything, and then, hands go in the mouth. Should we all be following just those basic guidelines of wash your hands for 20 seconds, don't touch your eyes, nose, and mouth. It's very elementary, but it appears it may be the most effective.
It is. We know it's the most effective. I mean, 20 years ago with the original SARS epidemic in 2002, that was the key
Actually, you know
intervention.
what, Dr. Evans, I hate to interrupt, but I'm going to put you on pause because we're going live now to Washington State.
Good morning.
We're going to listen into the governor
It's obviously
giving us
been
an
a very
update on the
busy week for
coronavirus.
all of us in the state in response to our COVID-19 outbreak, and we don't expect that to change in the near future, unfortunately. With me today are Health Department Secretary John Weisman, who will speak, Insurance Commissioner Mike Kreidler, Labor and Industries Director Joel Sachs, and State Health Officer Kathy Lofi will be making some comments and stand for your questions. First, I'd like to say that all of our hearts are with people who are suffering and have suffered in the state. It is significant. The anxiety that family members have about those who are in care or have been affected is profound. We recognize that, and I know all Washingtonians have them in all of our hearts, and we're going to do everything we can for these families. I want to repeat my appreciation for the emergency first responders and the healthcare workers. These ground level people are working day and night. There is obviously some risk to them, and they are showing both professionalism and courage, and I appreciate both. Our priorities in state government in this regard remain the same. We are attempting to do everything humanly possible to slow the spread of this virus, and we are doing all we can to encourage all Washingtonians to be effective leaders in this effort, to exercise a calm and deliberate decision-making in their personal and professional lives. And I unfortunately can say that that is happening. I've been pleased to see that people are acting with a view to science rather than fear, and a view that we are all in this together rather than pure self-interest, and we all be appreciative of Washingtonians' response. I want to thank the legislature for acting quickly in a bipartisan way to approve $125 million in emergency funding that can help a variety of individuals and governments respond to this emergency. The legislation has an emergency clause, which means the Office of Financial Management can begin to take action with these funds just as soon as I sign the bill. These funds are for state, local, and tribal entities to help carry out the directives of my emergency declaration. We're also expecting an infusion of millions of federal funds from Congress. I want to thank all our congressional delegation, Representative Del Benny particularly, our two senators, and everyone who's pitched in this regard. I've had several conversations or texts with Senator Murray, and I can tell you that our delegation has really been pitching in. At my request, the Department of Labor and Industries is working to ensure compensation protections for healthcare workers and first responders who cannot work because they may have been quarantined or may have contracted the viruses themselves. We should have their backs. It's the right thing to do. So our protection will include coverage for medical testing, treatment expenses, and time loss payments for healthcare workers and first responders who cannot work if they are sick or quarantined because of the COVID-19 virus. Labor and Industries is also encouraging employers to continue to pay workers who are quarantined after being exposed. Today, in accordance with my emergency proclamation, our insurance commissioner is issuing an emergency order to Washington State health insurers requiring them to waive copays and deductibles for anyone requiring testing and treatment for COVID-19. The order applies until May 4th, and I'm just great to see our really effective insurance commissioner jump into this task, and he'll speak in a moment. We're also providing operational and workplace guidance to all of our state employees to encourage a healthy workplace. That includes strongly encouraging people to stay home if they feel sick, maximizing abilities to work remotely out of the office, and for areas where employees heavily rely on mass transit, adjusting mass transit options so the number of employees riding simultaneously is reduced. Some of our scheduling can help reduce the load on the public transportation system. We are also encouraging non-essential meetings of over 10 to be postponed or held virtually in any way that is possible. We have good news on the expansion of testing capacity that Secretary Weissman will talk about shortly. We've been involved intensely in this regard. I'm happy we're going to have some good news on that. Yesterday, I met with emergency operations workers at Camp Murray in Tacoma and at the Department of Health in Tumwater. These people are doing tremendous work. I also visited a potential quarantine site on Department of Corrections property at the Maple Lane School. And I left feeling confident that this site can help us meet our needs to help people who have to be in isolation be safe and reasonably comfortable during that period of time. State officials are in touch with local officials in South Thurston County about that operation to answer any concerns there. I'm very confident that that is a safe facility. It is geographically remote, and I feel very confident about that siting. This virus is spread by close contact with infective individuals. Quarantine sites reduce this risk. And I was pleased to hear from the director of the CDC yesterday that he thinks Washington State has the best public health system in the nation. And we've been seeing it at work. The USA Today ran a story this week saying Washington was well prepared for an epidemic relative to our peers in the other 49 states. There are many Washingtonians working at the state and local levels who deserve our thanks for putting us in a position to be able to say that. As you know, Vice President Pence is visiting Washington today. I've already had several conversations with him in the last week, and we will be having more this evening. I am pleased that the federal government has responded to my request and requests of several other governors that we have more federal resources to address this outbreak, and it will only improve and expand our response going forward. I'm also pleased that the federal government.
Listening live there to the governor of Washington State, Governor Jay Inslee, talking about the situation with the coronavirus in his state. He made an emphasis on thanking Washingtonians for making what he called deliberate decision making. Hold off on large meetings that aren't crucial, and he encouraged people to follow science instead of fear, as he put it, in making decisions about how to move about their daily lives. Certainly, when you declare a state of emergency, people can get very nervous about that, but really that step is being taken in California and a number of other states as well, to increase the resources available to help the people of Washington State in this case. Let's go right back to Dr. Evans. I know you were listening and watching Governor Jay Inslee with me. Tell me about that state of emergency. How do you balance perhaps heightening some fears, but then also bringing in some crucial resources?
It's a tough balance, because once you make that declaration, you see things like the stock market go down, and people are now flooding calling the county all the time about questions and concerns. And I'm sorry, but health departments, it's been proven, they've been cut. They've had large cuts over the past 10 to 20 years. And it's just a fact of life. And so them now getting a flood of money is certainly going to help them. They'll be able to hire more staff, because it's going to involve an incredible amount of staffing. I mean, just even in our hospital alone, just the amount of time that is spent for planning for this, even though we don't even have a single case, is just impactful. Yeah. Taking time away from us just doing our regular job, which is already busy enough.
Right. Let's talk about this at the very personal level. You do your work in Marin County, which is just north of San Francisco in the Bay Area. I assume that you come in contact with or even personally see people who do not have health insurance. I hear it all the time. People say, I'm not feeling well, I don't have health insurance, or I don't have good health insurance. I think I'll just try to tough this one out at home. There is help being asked for in California and other states to help specifically those people who cannot afford to go to the doctor on any given day, and certainly not with something like the coronavirus, to help those people walk in the doors and get the same care that anyone else gets.
Yeah, that's great. It's phenomenal, because what happens is they'll come to the hospital because emergency rooms have to take care of them. Right. But when they leave the hospital, guess what? Here comes a monumental bill for just a simple test for flu is going to be hundreds of dollars. And then you add on a test for SARS-CoV-2, and there's another $1,000. So yeah, I mean, it would make the person want to stay home and potentially get other people sick. And we've seen how contagious this is. It's on the level, probably along the lines of the level of the seasonal flu in terms of contagiousness. In the seasonal flu, about 25% of the given human population get the flu in a given flu season. So it just shows you how potentially dangerous it is.
And let's go ahead and compare the seasonal flu with what we're seeing with the coronavirus. Talk to me in numbers and also talk to me about specifically the death rate involved with both.
Well, it's questionable in terms of this COVID-19 illness, in terms of the death rate. What's been reported by a lot of data that we've gotten from other countries, not as much from this country because we haven't seen that many cases, it's probably around the lines of 2%. The WHO came out the other day, commented about being 3%, but they made a caveat saying that they're not testing everyone, so if you probably include people who are relatively mildly ill or asymptomatic, that number is going to go probably down to 1%.
Okay. So
but when you compare that to the seasonal flu death rate, on average, depending on the season, 0.1%.
Okay. All right. Dr. Evans, we're going to have to put you on a quick pause here because we're going to go to the Twin Cities, St. Paul, Minnesota here, where Fox reporter Theo Keith is standing by. This is where the vice president will be today talking about the coronavirus task force that Mike Pence is heading up.
Well, in fact, Gasia, he is here right now at 3M in Maplewood, Minnesota, a suburb of Minneapolis and St. Paul. He got here about noon, and he has been meeting with both state officials here in Minnesota and also executives from 3M in one of the buildings on the very sprawling 3M campus just back behind me. He told the 3M officials that their company is on the front lines of this fight against coronavirus. 3M manufactures face masks for healthcare workers, and the vice president says that 3M has a contract to manufacture millions of face masks now. We're not sure the exact number. He also said that it's an all-hands-on-deck fight as far as what the government's response to coronavirus is. He met with Governor Tim Walz, the Minnesota governor, first-term Democrat, just earlier, as well as the state commissioner of health, and he met with the CEO of 3M, as well as 3 other corporate executives. Once again, 3M is manufacturing what we're told is millions of face masks for healthcare workers in the fight against coronavirus. The vice president is then going to be wheels up here from Minneapolis in just a little while. He is going to Tacoma, Washington, where he is going to meet with the governor of Washington, Jay Inslee, and also take a tour of that state's emergency operations center. Of course, there's a state of emergency in Washington state where several people have died already from the coronavirus. It is really the epicenter of the outbreak so far. Here in Minnesota, we have no confirmed cases of coronavirus. The state health officials say that 13 people have been tested and tested negative. 2 University of Minnesota students are being told to self-quarantine for the next 2 weeks because they came in contact while abroad with someone who then tested positive for the coronavirus. But they did not show any signs of coronavirus, so they were able to take a flight back here to Minneapolis within the last few days. State health officials are grappling with how much this is going to cost, though. They do fully expect the coronavirus to come here to Minnesota. They are expecting a $21 million initial cost, about half of that for staffing. They expect to put about 100 state public health officials on a coronavirus response to the tune of about $10 million. The other $11 million or so going to local health departments and also various other ways to fight it. They need that money from state lawmakers, and they put together a $21 million request. Much smaller than we have seen from other states, including Washington state. But again, the coronavirus, we have no confirmed cases yet here in Minnesota.
So Theo, even with no confirmed cases, I wonder if you're seeing what I'm seeing. I took mass transit last weekend and I saw people wearing masks, people doing fist bumps or elbow touches instead of hugging. Is that happening where you are?
Haven't seen that yet, although I imagine as we start to get into some of the bigger events, basketball games, baseball season starting up, the Minnesota Twins here in the next 3 weeks or so, I would anticipate that is going to be seen. I cover the state capitol, And there has already been talk there. A lot of people, thousands of people every day between the lawmakers, staff, and people who are coming to the Capitol in and out every day. And there has been talk about how do we keep things safe there in such a public place. Face masks, I think we'll start to see. And, really walking into a lot of government buildings, we see hand sanitizer as well for people to use. I think those sorts of preventative measures are already being taken and will certainly ramp up as the governor and state health officials admit. We're going to see cases of coronavirus here, so we need to be prepared for it, is essentially their message at this point.
This is a question I could only ask somebody who is wearing a parka, where people in other parts of the country are in shorts and flip-flops. The fact that I doubt many people in St. Paul are out and about, having large picnics and parties and essentially being together, does that help?
Sure.
or perhaps hinder the spread of the coronavirus?
Well, yeah, you can see I need some windshield wipers for my glasses right now. It's a spitting rain-snow mix here today, although the weather is going to be quite nice over the weekend, topping 60 degrees, which is extremely warm for this time of year. And so people will be out and about this weekend needing to take some of those precautionary measures. I think certainly having the vice president here today, as well as the response of state officials, the governor, and having 3M here, and really having that heightened awareness of the face masks and the production of that and so on. I think people here have gotten a heavy dose of warnings about the coronavirus and what precautions they need to take as part of that.
All right, Theo Keith there in St. Paul, Minnesota. Thank you so much for joining us. I know that he said that he's right in front of 3M there,
Sure.
which is full steam ahead. Looks like I doubt anybody there has the day off, but there are a number of companies that are asking their workers to work from home if they can. A couple of major events have been canceled. So let's talk about what's happening in Austin, Texas. It is one of the biggest events of the year, and as of right now, South by Southwest is still happening. South by Southwest is a huge, long-running music, tech festival, gets people from all over the country and the world. At this point, South by Southwest is expected to still kick off next Friday. It is all the talk on social media, such as what this person wrote. Dave tweets, "Hey, South by Southwest, are you seeing this? Festivals and conferences all over the world are canceling and are postponing their events in the wake of the coronavirus." He writes, "Get over yourself. Suck up the loss of revenue and focus on the safety of society." Then links a tweet from a newspaper there. Another person clearly concerned and also chiming in. We see this tweet which reads, "One of the big companies to cancel their South by Southwest attendance. One by one big companies is canceling their South by Southwest attendance. As much as I want to see and love Chris Evans and big events such as South by Southwest or Comic-Con," he writes, "If things were getting worse and feared would cost his health due to coronavirus, maybe he should skip it too." So writing in there with some thoughts on whether or not it is prudent to go ahead with something like South by Southwest, which again brings thousands and thousands of people in from all over the world. So what do health officials have to say about this, specifically in Austin, where South by Southwest is happening? Let's turn to Dr. Mark Escott from the Austin Public Health Authority for some answers.
I will tell you that one of the concerns is if we shut down or make the recommendation to shut down South by Southwest, people will still continue to come here. They will travel, they'll do what they were normally going to do, but without that organizational structure that South by Southwest provides. I will say that all along, South by Southwest has been extremely responsive to requests for mitigation strategies. That so far has included increasing availability of hand washing, increasing availability of hand sanitizers, messaging to attendees, signs placed in venues and other locations in the convention center and throughout the festival to remind folks of the importance of personal hygiene. In addition to that, South by Southwest just this weekend agreed to screen employees and volunteers to make sure that they themselves do not have a febrile illness or a fever prior to working. It is likely that this expert panel will advise and recommend further strategies to mitigate risk. Obviously, as the number of people increases at a particular venue, and the density of that venue increases, the risk of spread of infection of COVID-19, influenza, or anything else is going to increase. So part of that discussion is where's the risk the most, and how can we mitigate that risk?
Community. From a health perspective, does having an event like South by Southwest in the community put Austin at an increased risk for COVID-19? Like, is inherently having a festival here in Austin something that increases our risk or likelihood for transmission?
So that's a challenging question, and it's challenging because the evidence is not clear that holding large events overall changes the magnitude of outbreaks. There is some evidence that it may shift it sooner than it may have been otherwise. And that's one of the key things that this expert panel is evaluating is what is the increased risk by having that festival here, and can we mitigate that risk by enforcing these hand hygiene messages, ensuring that hand sanitizer and hand washing is available, and possibly increasing the distance between people at venues. This is what I was talking about earlier about, some venues are going to be lower risk than other venues. As the crowds grow and the people get closer together, the risk is going to increase for transmission of COVID-19 potentially, and certainly influenza, because we're still in the midst of a significant influenza season. It's multidimensional, this challenge, and is one that is complicated. I'll tell you quite honestly, we're also concerned that because South by Southwest has been so engaged in helping us mitigate, that if we shut it down, that people will come to this community anyway. They're going to go to restaurants and bars and public gatherings anyway, but we won't have all of this. We won't have the messaging, we won't have the hand sanitizer, we won't have those additional mitigation steps that South by Southwest has really been partners with us on.
Listening in there to a doctor as he describes what's happening in Austin. Again, it's the site of the big South by Southwest Music and Tech Conference, which as of right now is still set to happen. A lot of people certainly concerned about the festival itself and the impact it'll have on people who live in and around Austin. So getting some answers there from the doctor. Just a quick good morning or good afternoon to you wherever you might be. My name is Gasia Mikaelian, and you are joining us as we bring you what is going to be a daily live update on the coronavirus outbreak here in the United States, and we'll also look globally as well. We are starting our live stream every day at 1 o'clock in the afternoon Eastern Time, 10 o'clock Pacific. And we are again meaning to bring you the latest information to help calm your fears, but also to get you the information you need to know to go about your daily life. Work, school, all of the above will help you get through it as safely as possible. And if you have questions, we'd love to hear from you. I know if you're watching this on your Fox television station's Facebook page, just hit us with a couple comments and I'd be more than happy to pass those along to our experts or do my best to answer them myself. So again, we're in the middle of this coronavirus coverage. We are also going to look at a national health policy level of what's happening. As we've been reporting and showing you, Vice President Mike Pence has been named the head of the coronavirus task force. And I'd like to bring in now, if I can, a Washington Post's health policy reporter, Amy Goldstein, to talk more about the coronavirus and the national response to it. Thank you for joining me, Amy.
Glad to be with you.
All right, let's start with Vice President Mike Pence and what he had to say about testing. And many people feel there is a shortage of coronavirus test kits.
That's right. Well, on Tuesday, it was become a daily briefing at the White House by the coronavirus task force. The Vice President said that the Center for Disease Control and Prevention was going to change its guidance a little bit so that any American who wanted to get a coronavirus test could ask their doctor, and if the doctor agreed, get a test. He said that on a day when the administration, the Trump administration, had been criticized a lot for the fact that tests have been slow to become available. And in particular, Senator Patty Murray from Washington State, where obviously there's a big outbreak, was very critical that she knew people she represented who've been asking for tests and can't get one. So that's what the Vice President was responding to.
Is there a general appreciation, or what are people's reactions to the Vice President's comments? And maybe not only those in the health and medical community? What's the general feeling about his response?
Well, I was talking yesterday to a number of doctors in King County, Washington, where the sort of heart of the biggest outbreak is at the moment. And they were actually quite concerned on two levels. They, like people elsewhere in the country, were concerned that they still don't have access to material to give patients the tests. But beyond that, they were concerned that even when the testing becomes much more available pretty soon, they want to be careful that patients who think that they might be infected don't just show up at doctor's offices or at clinics or at hospitals, where if they are infected, they've got the potential to convey that to other people. They're saying that it's really important that people call in if they want to get a test. People who are healthy but think maybe they were at some big gathering where somebody was infected, or people who might have a cold but might have something worse than a cold. They just think that if the vice president encourages people to march into their doctor's offices or clinics, that could be counterproductive.
Amy, I don't know if you can look as far back as the SARS outbreak or H1N1. Can you compare or contrast at all the current government response to the coronavirus to other similar health scares this country has been through in the somewhat recent years?
Well, I think that any time there's a new virus that shows up, it takes a little while to first get a test that can be effective in identifying who has it, to get it available, and to kind of figure out where this is going to spread, how serious it is. So there's been a certain part of that process that's what's happened before that's happening this time. At the same time, there have been critics of the Trump administration for not being as kind of quick on their feet as perhaps they should have to realize that this was going to be serious and fast spreading in certain communities. And in addition to conveying the messages that this administration has been, that people should be taking ordinary measures to protect themselves from viruses, things like washing hands and not touching their faces, that the test really needed to get developed and get out there fast.
I assume if your newsroom is anything like ours, Amy, there's a jar of Purell on almost every desk.
We have signs on the bathroom saying, wash your hands.
We do too. Amy Goldstein of the Washington Post health policy reporter, thank you so much for joining me. Let's go ahead and take you now to the other side of the country, to San Francisco, where the mayor of San Francisco, Mayor London Breed, is about to speak any minute now as she addresses the people of her city on the coronavirus situation. Mayor Breed took the step to announce I'm not sure if the technical word was a state of emergency, but certainly a concern about what's happening in San Francisco. If you don't know, San Francisco has an awful lot of traffic, if you will, from people from other countries, and almost not quite immediately, but very soon after the outbreak started in Wuhan, China, San Francisco's major airport, SFO, made the decision to stop direct flights incoming from China. So that is sort of a small, well, medium-sized effect that we've seen on travel as it relates to people coming in and out of San Francisco. We're about to hear the daily, an update from San Francisco Mayor London Breed. All this happening as there's the cruise ship, the Grand Princess, which was supposed to dock in her city very soon, now being held off the coast of California, as a number of passengers on the Grand Princess cruise ship say they are complaining of flu-like symptoms, and they're being held there on the ship in the open international waters to be tested. So we assume that Mayor Breed will talk about that. We have to swing back to markets here because I've been keeping half an eye on the Dow as we've been showing you those numbers at the bottom left-hand side of your screen. And look, bigger, you can really tell what's happening. We are still just about as low as we've been all session. Markets close here in less than 2 hours. The Dow Jones is down by almost 3.5 full percentage points, losing 950 plus points at this moment in time. The S&P is suffering a loss of about 3.33%. S&P is down by 105 points. The NASDAQ is down by almost 3 full percentage points. A lot of investors certainly still wary about what is happening with the coronavirus and the effect it is having on business. So as we mention all this, I would like to again remind you that we are so appreciative that you're joining us for this. It's a daily webcast on the coronavirus itself. The latest cases that we're seeing, the newest information that we have to bring you, as information is changing from minute to minute. Let's go ahead and take you now to Houston. As I pause to take a quick breath here, let me make sure I have my facts right before I give them to you. Texas just confirmed its first case of the coronavirus on Wednesday. That's in Fort Bend County, southwest of Houston. The health department there confirmed what it calls a presumptive positive case. This case showing up in a man in his 70s who had traveled abroad. You may have heard that phrase, presumptive positive. It means that the county got a positive lab result for coronavirus, but that has yet to be verified by the CDC. Health officials there in Fort Bend County did hold a press conference yesterday saying that they are now able to test for the coronavirus in local laboratories, and they also updated the public on the first case in Texas. So let's listen now to that.
Good afternoon, everyone. I am KP George, your Fort Bend County Judge. As we have promised, the information, as and when the information is available, we do everything in our power to keep our residents and all jurisdictions informed about this situation. We are working around the clock with all local, regional, and statewide health authority to monitor the situation and update the public. While this is a serious health threat, we encourage residents to rely on verifiable source of information and remain calm. Next, I will introduce a team of experts throughout from this region. We are blessed to have some of the top public health officials with us today. With that, I will introduce to you Fort Bend County Health and Human Services Director, Dr. Jacqueline Minter, to provide an update on the individual situation. Thank you. Dr. Minter.
Thank you, Judge George, and good evening. First, I would like to acknowledge the presence of our regional local health authorities, Dr. David Pearce from the City of Houston and Dr. Umer Shah from Harris County. As you know, diseases and disasters do not respect jurisdictional boundaries. We are fortunate to have a great relationship and a great partnership within this region, and I sincerely appreciate the support of my colleagues. Thank you. At 4 p.m. this afternoon, I was notified that a person who resides in Fort Bend County has a presumptive positive test for COVID-19. The test was performed by the Houston Health Department Laboratory.
A quick pause here in hearing from the officials in Texas. We see now on your screen San Francisco Mayor London Breed about to brief her city on the latest on the coronavirus in San Francisco.
Coming at such short notice. Since the beginning of the outbreak of the coronavirus, we here in San Francisco have done everything we can starting back in January to prepare. In fact, we operated immediately our emergency operations center in order to maintain clear information from around the country and around the world to understand what was happening and to try and make sure that we were providing the public with the best information that we had to be fully transparent, but also using the data and the science to ensure that what was being communicated was entirely accurate. And as a result of that work since January, in February, just February 25th, we declared a public state of emergency here in San Francisco so that we can further prepare for the possible arrival of the coronavirus here in San Francisco. And as I said, through this process, it has been all about protecting public health and making sure that we were doing everything we can to communicate accurate information with what we know. Sometimes a lot of information gets out there. It's not entirely true, but it's important that everything that we know is communicated directly to the public so that we have accurate information every step of the way. Today, we are announcing the first 2 cases of coronavirus in our city. They've been detected here in San Francisco, and these individuals are contained. And I will let Dr. Colfax talk a little bit more about the details. And I want to be clear that we have been planning this for weeks. And so we are prepared as a city. We want people to continue to do exactly what we've asked people to do, and that is make sure that you're washing your hands and that you're doing the things that are going to help to protect yourselves in the midst of what we know could continue to be a virus that spreads. And so at this time, I'd like to ask Dr. Grant Colfax to come up and provide the details of the 2 cases that were just diagnosed.
Good morning. I'm Grant Colfax, Director of Health, and thank you, Mayor. The San Francisco Department of Health lab conducted COVID-19 tests for 2 patients and have recently found that 2 patients are infected. These results were reported to me this morning. The 2 patients are unrelated, and both are being cared for at separate hospitals in San Francisco. The patients do not have a history of travel to a location with confirmed COVID-19 cases and have no known contact with a person with a confirmed COVID-19 case. These cases are like similar cases we are seeing in the region. They are indicative of community transmission of COVID-19. The patients are in fair and serious condition and are being treated in isolation at the 2 different San Francisco hospitals. All appropriate precautions for the patient, visitors, and hospital staff are being taken. The health department has informed the patient's families this morning and is investigating the patient's history and contacts to protect the health of individuals and to help slow the spread of the virus in the community. Patient number 1 is a man in his 90s, and he is hospitalized in serious condition. The patient has underlying health conditions. He was tested by the DPH lab, and the results were given to me this morning. Patient number 2 is a woman in her 40s, and she is hospitalized in fair condition. Again, her results were provided to me this morning. To protect privacy, San Francisco will not be releasing further patient information or identifying the hospitals in which the patients are being treated. Unfortunately, these cases of COVID-19 in San Francisco residents do not come as a surprise. Given the virus has been detected in the Bay Area, California, and increasingly across the country, San Francisco has been preparing for the appearance of COVID-19 in the community for many weeks. Last week, the city declared a local emergency to boost our preparedness in anticipation of just this situation. The people who are sick are getting the best care provided by our outstanding healthcare professionals. We do not know at this point how they were exposed to the virus, which again suggests it is spreading in the community. We expected that to happen, we anticipated that, and are further investigating the circumstances of these patients' exposure. Let me be very clear. This virus does not discriminate. Stigma and discrimination is unacceptable in this time when we need to come together as a community to protect public health. All of us need to do our part. Do the basic things. Wash your hands with soap and water for 20 seconds. Cheap soap is just as good as expensive soap. If you do not have availability of a sink or soap, use hand sanitizer. Please do not come to work or go to school if you are sick. Stay at home, and if necessary, contact your healthcare provider. Ensure that when you greet people, you can do an elbow bump. Do not shake hands at this time. That is public health data that shows that that reduces the risk of transmission. I also want to stress that due to the fact that we started local testing in San Francisco on Monday at our public health lab, we are testing more people. We now have availability of test kits to test those at most risk for disease. There is no on-demand testing in San Francisco at this time, And people who have questions about their symptoms and whether they should be potentially tested should consult with their healthcare provider. Additional information from the health department is available on our website at sfdph, that's sfdph.org. Thank you.
Thank you, Dr. Colfax. And I also want to thank the members of the Board of Supervisors who are joining us here today, as well as other department heads. And I want to also reiterate that this disease does not discriminate against anyone. And the fact is, there's been a lot of xenophobia against folks who are part of our Asian community. And we know that when there is a stigma attached to a particular group of people, especially around such an important public health issue, then it's less likely that people will be willing to come forward, which means that the health outcomes we need to address this virus may not occur. So it is up to us to come together as a community and to know that at this point, based on what we know, based on the data, based on the information that we're providing, that we need to make sure that everyone feels safe, that everyone feels that they can talk to their healthcare providers, and that we're not discriminating against any particular race in our community. And with that, I want to talk a little bit about the cruise ship, which you heard the announcement yesterday that a cruise ship was scheduled to return to San Francisco that contained individuals with flu-like symptoms. We are working closely with the Coast Guard, with the Center for Disease Control, and with the state to address this issue. We know it's important that we take precautionary steps before any consideration occurs to determine where this cruise ship will land. And I want to be clear with the people of San Francisco that we're doing everything we can to work with the state and the federal partners to prepare if it does come to San Francisco, but there are certain criteria that must be met before that occurs. So at this time, I want to ask the Director of the Department of Emergency Management, Mikaelian Carroll, to talk more specifically about what that entails.
Thank you, Mayor Breed. Good morning. This is where we currently stand regarding the Princess cruise ship that was scheduled to return to San Francisco this week. At this time, the CDC, the California State Health Department, and the Governor's Office of Emergency Services with the U.S. Coast Guard are working to determine if COVID-19 is present on the ship. There are 2,383 passengers on board the ship and 1,100 crew members. Of that, a total of 35 have shown flu-like symptoms during the course of this 15-day cruise. Many of those people have recovered and are no longer showing flu-like symptoms. Testing protocols are being put into place on the ship for those passengers and crew that have shown flu-like symptoms or may have been exposed to the virus, and that is happening today. Once we have results from the tests, the CDC and the state will determine the most appropriate location for the ship to berth, and the location needs to provide for the safety of the surrounding community as well as the passengers and crew. The CDC and the state are fully engaged in determining a location that can most appropriately address the health of those passengers that may have COVID-19 and the safety of those passengers not impacted, as well as the surrounding community. The CDC and the state are considering a number of locations, including San Francisco. However, where the ship will dock will be dependent on if the location can enact the proper CDC, state, and local protocols and has the infrastructure to protect the entire community. Our main concern is whether we can ensure those passengers that may be infected receive the care that is needed, those passengers not impacted can safely travel home, and the health and safety of our local community. The This is an evolving situation that requires the federal government, the state of California, and San Francisco to ensure all the best practices and protocols are in place to accept any cruise ship that may require COVID-19 mitigation. Thank you. Sorry.
Thank you, Mary Ellen. And I just want to say that San Francisco is embarking on territory that is not unfamiliar to us. You all know that we have some of the most incredible public health experts anywhere in the world right here in our city. We've dealt with challenges over the years, whether it was the HIV crisis or SARS or H1N1, and we got through those events because we came together as a city, because we put forward best practices, and because we continue to make sure that we communicate clearly on things that the public can do in order to make sure that we protect public health. Ultimately, that is our goal, and we will continue to do everything we can to make sure that as soon as we have information available, as soon as we have accurate information available, we provide that information, and that is what we are doing here today. So I want to thank you all for coming, and at this time we are opening up for questions. Were tests administered this morning? Dr. Colfax?
The tests
I
were
apologize.
collected
I'm
yesterday.
taking notes here as
The
I'm
results
listening
came in.
into the director of the Public Health Department, also to San Francisco Mayor London Breed. I will again highlight the breaking news that we just brought you live here from San Francisco. The mayor announcing the first 2 patients diagnosed with coronavirus in the city of San Francisco. And it looks like it was 2 cases of community transmission. So I'll take you through what San Francisco has been doing, and then we'll focus on these 2 people when we bring the doctor back in 1 second. First, actually, you know what, Dr. Evans, let's go straight to you right now. Community transmission. The 2 people the mayor and the health director just talked about had not traveled to an area where there has been a coronavirus outbreak. They're also not known to have come in contact directly with someone who is infected with coronavirus. So explain for us how these 2 may have gotten it.
It's hard to know. Where do they travel? They may not have gone to Italy or Japan or China, but perhaps they were on this cruise ship. This cruise ship made a stop in San Francisco and dropped people off. Maybe they're testing these people and now getting those results back. It's hard to really know. It's good that it's being picked up. It's going to then involve more testing. They're going to look at their contacts and test them. So it's a lot of work. And thankfully they have good people that work in that department.
We heard the mayor say, and I mentioned it earlier, San Francisco declared a local public state of emergency in that city back on February 25th. We heard the mayor repeat this. This is something we were expecting. We are ready for these first 2 cases. How, though, do these first 2 cases in San Francisco that appear to be from community transmission in any way ramp up the response by the city or its residents?
Yeah, I mean, they knew it was coming. They saw in the neighboring county in Santa Clara have community transmission, so they knew it was coming. They're being very proactive, which is great. Really, the rate limiting factor here is just the ability to test. They're going to be testing a lot, and thankfully now it's up and running. They have those test kits in the city. That's really what's key.
Is this a case where you expect doctors to take these 2 patients, and I'll give their specifics quickly here. Patient number 1, as he was called, is said to be a man in his 90s, is in serious condition with underlying health concerns. Patient number 2 is only identified as a woman in her 40s. She is said to be in fair condition. What steps are health workers taking then to sort of trace back where patient 1 and patient 2 may have been? Because it's only now that they've been diagnosed and that's been announced. How much before that can you still be a danger to others?
That's a great question. They're going to look and see at the onset of illness, really, any sort of symptom, whether it be a fever or possibly nausea or vomiting, which can happen as a presenting complaint, or obviously a cough, which is probably the most common complaint out of all of them. So we'll look at that. You know, generally speaking, that's when contagiousness occurs, although there have been reports of patients who are relatively and minimally symptomatic have had some sort of transmission, and these are case reports, and you know it can be sensationalized, But they're going to have a lot of work ahead of them because, I mean, depending on where these patients were, how big their families are, whether they went here or there, and whether maybe they were smart enough where the given patient had a mask and was wearing it the whole time.
Well, let me stop you because the most recent advice we're hearing for masks is don't go out and buy a mask unless you're a health worker and know how to use it properly and need one. We happen to have a mask floating around the news. When I put it on, I thought, oh my God, I'm touching my eyes, I'm touching my nose, I'm fiddling with it, which can only make things worse. What's your best advice on masks?
Well, I beg that, I mean, you know, masks do protect people. It's not going to be 100% protective. It's how you wear your mask and take it off too. But if you're sick, you got a cough, it's going to help. Because one of the biggest questions, one of the most important questions that we ask when somebody comes to the hospital is, when did they get the mask on? When did that sick person get that mask on? Because once that sick person who's coughing all over themselves and into the environment, once they get that mask on, the degree of contagiousness from them to other people definitely goes down exponentially. So that's really a key factor. If you're sick, wear a mask.
So you're saying if you're sick, wear a mask. If I'm going to take a ride on public transit and I'm afraid of catching who knows what, I shouldn't put that mask on because it's not a good preventative measure in that sense.
You know, it's not going to be 100% preventative. It's going to be more the hand hygiene. I can't say that wearing a mask is going to be minimally effective. It may prevent a little bit. It's hard to really know, but it's really the person who is sick wearing that mask. That's actually going to be pretty impactful, I believe.
Okay, let's talk about the Health Department Director, Grant Colfax. He brought it down to basics. He said, look, wash your hands. That's the best advice I can give. He even said cheap soap is just as good as the expensive stuff. He said, stay home when you're sick. And then he said something that is so basic, but I haven't heard him say before. He said, don't shake hands. So it looks like San Franciscans, we have to go to the fist bump or the elbow tap.
Yeah, well, there's a fancy term for this. It's called social distancing. Okay. It's a relatively new term. I guess we can Google it and look it up. But that's really coming into play. And this is not a recommendation everywhere in the country, but here in San Francisco, it's hit us. Social distancing. Look it up. That's really what we have to start considering.
Okay. Dr. Evans, thank you so much again. The breaking news that we just brought you, and you heard it with us, San Francisco Mayor London Breed just announcing the first 2 cases of coronavirus confirmed in her city. 2 patients, one, a man in his 90s in serious condition, said to have underlying health problems. The second patient described only as a woman in her 40s. She is in fair condition. The mayor said that the people who are sick are getting the best care possible. However, it is spreading in the community because neither of these 2 confirmed coronavirus patients in San Francisco is known to have traveled to an area where there is a widespread coronavirus outbreak, nor have they been known to come in contact with someone who has the coronavirus. So again, as we bring you this latest information live, we're also going to remind you what's happening in states that have coronavirus cases confirmed. California has 45 confirmed coronavirus cases. You can see on your screen, Washington State has 39. New York has 6 confirmed coronavirus cases. Illinois is next with 5. Then Oregon and Florida come in the number 5 spot. Those states each have 3 confirmed cases of the coronavirus. Just yesterday here in California, our state announced its first death, a man in Placer County. So again, we're bringing you the latest breaking news on the coronavirus. I also want to highlight something we heard the mayor of San Francisco say a moment ago that may or may not be affecting you and your community. She said now is not the time for xenophobia, for fear of others. And she said this virus does not discriminate. I'm sure that you and your local Fox television stations have been reporting on perhaps the impact the coronavirus might be having on the local Chinatowns. I know in San Francisco and in Oakland, I've seen reporting that says business owners are reporting dramatic drops in business during what should have been one of the busiest times of the year for them, just coming off of the Chinese New Year. And they said streets were empty, restaurants were bare, and they were definitely taking a financial hit. But again, we heard the San Francisco mayor say that she has seen some reported instances of xenophobia. Flatly, it's discrimination and racism, and she said now is not the time to separate yourself from others in that ugly sense. This is a time to come together as a city in San Francisco or wherever you are, get the latest information, take smart precautions, do not overreact, but keep yourself and others safe. And again, to hear the director of the Public Health Department in San Francisco say it comes down to basics. Wash your hands, stay home when you're sick, and don't shake hands. That's good advice for us all. So we're going to put a quick pause in our live coverage. coverage here online, but we are going to come back to this again tomorrow, as this is just the beginning of what is going to be a daily live webcast focusing on the coronavirus. You may have questions, and we're finding ways for you to get that to us either through Twitter or Facebook or right there on your station's page. We're bringing in experts from around the country. We're also examining the impact this is having on the financial markets locally and worldwide. Also, events such as South by Southwest in Austin, as of right now, are still on, but many people concerned about getting thousands of people together in such a tight space. So I will leave you for now. I look forward to joining you tomorrow at the same time. Again, you can join us live here online starting at 10 a.m. Pacific or 1 p.m. Eastern for more coronavirus information live from your Fox television stations. I thank you for joining me, and I'll see you tomorrow.